So everyone, me and the famous Dr. Al put together a presentation for you, which we're still setting up. And while we wait to be setting up, I guess I'll show you the guide for the presentation. So, yeah. Okay, so this is the guide. This is water. This is sodium, aka Na. And these are some awesomes. As you can see, the different colors, because there'll be different colors. So the clear one's water, blue clear is NaOH sodium, and the rainbow glittery balls are some awesomes. So yeah, I do apologize if you hear any dog barking. So okay, so we're gonna start in 3, 2, 1, go.
All right, so here's our blood or serum. Here's our tubule or our duct of the kidney. And remember that anything that's not reabsorbed from the tubule or the duct is going to end up in the toilet. And here's the little urine specimen collecting cup, okay? So normal, we've got a little bit of sodium, and we've got some, let's say 140 milliequivalents. We've got osms of about 290. And we've got also some sodium depending on how much we're eating. And consuming some sodium, some water, and some osms that are going to end up in the urine. What happens in Mr. P is, let's just say maybe low sodium, but certainly low blood pressure is sensed by the juxtaglomerular as well as the baroreceptors. Here's some carotid baroreceptors, and they say, hey, we have low blood pressure. Now, it really is just low effective circulating volume, but they think, we don't have enough fluid or sodium. Let's go into action. So we secrete some renin here, and that's going to ultimately result in angiotensin 2, which is going to pull back some sodium and some water, some sodium and some water. Then the angiotensin 2 cascade ends in aldosterone. We're going to pull back some sodium, and the water's like, me too. I follow sodium. We follow sodium, says the water, okay? So we're getting lots of sodium. Then, remember, don't forget the posterior pituitary gets in on the action. We have ADH release, and that's where we're getting just water. A lot of water. Okay, so you can see what's happening here when you think about concentration. Yes, we have more total sodium, because remember we started with just 4, okay? We added a bunch in the serum, but it's all diluted out by all this water. Same with the osms. And you can see that here what's going to end up in the urine is low sodium. And, okay.
Ready? It's going.
Okay, so to summarize, so we have, this was what the sodium we started with. We have more total body sodium. We've added all these, but the overall concentration of the sodium is lower because look how much water we have left here. The osms, same absolute number of osms, concentration less because it's all diluted out now. If we look at what we're going to be collecting in our urine sample cup, we have low sodium, okay, because we reabsorbed a bunch. We have high osms because we don't have that much water compared to how we started. Okay, so the urine sodium tells us that our RAS system, our angio and our aldo, were working to pull the sodium back in, okay, and our urine osms, which is high relatively speaking, tells us that our ADH was working because it pulled all this water back in. Now you look at this, look how crowded it is here. This can't possibly all stay in the vessels. So guess what? Increased hydrostatic pressure. It's going to come out of the vessels. And where is it going to end up? It's going to end up in the belly, in the lungs, in the subcutaneous tissues of the lower extremities. It's going to be edema, effusions, and ascites.
Thank you so much for watching. This was our 5th time trying this, and I'm so glad it worked. So come back for another video. Goodbye. Also, this is an and on YouTube as unlisted, so don't mind. So you can't watch it at home. Sorry.